Arteries are the largest vessel and carry blood from the heart to the tissues. Arterial blood is bright red and spurts with each heartbeat. Arterial bleeding is the most serious because the patient can lose a lot of blood quickly. If a major artery is cut, death can occur in 1 minute if not treated. Activate the emergency medical service immediately for this type of bleeding. Veins lead from the tissues back to the heart. Venous blood is dark red and flows steadily without spurts. Venous bleeding can also be life-threatening. If you cannot control it, contact the emergency medical service and monitor the patient's cycle of care. Capillaries are tiny blood vessels between the arteries and veins where the blood and tissues exchange oxygen. Capillary bleeding tends to be slow and easily controlled. To begin helping a patient with serious bleeding, first assess the scene to make sure it's safe for you to approach. Put on appropriate barriers and deliver your responder statement, asking the patient if you can help. If the patient says yes, call emergency medical services. Reassure the patient as you treat for bleeding, and if needed, assist the patient into a position of comfort while treating. Since the patient is responsive and breathing normally, you can sidestep CPR, chest compressions, opening an airway, and breathing for the patient. With a responsive patient, proceed immediately to the S in ABCABS on the cycle of care. The first S in ABCABS prompts you to check for serious bleeding. To control serious bleeding, use sustained direct pressure. Put a clean cloth or dressing on the wound and apply constant pressure. If you have no dressing, use a piece of cloth or even just your gloved hand if there's nothing available. Maintain the pressure continuously, but you may periodically release pressure to see if the bleeding has slowed or stopped. In addition to sustained direct pressure, you may also use a pressure bandage. While maintaining direct pressure, tie another dressing over the initial one. The patient may assist if able. If the dressing becomes blood-soaked, don't remove it. Instead, add another on top and continue direct pressure. Applying sustained direct pressure and pressure bandages best controls bleeding. However, there may be regional treatment variations, such as elevating bleeding limbs, giving the patient oxygen, and applying a tourniquet as a last resort to controlling serious bleeding.
When using a hemostatic dressing, always follow the manufacturer's directions for use. Remove the dressing from the packaging. The dressing is folded in a Z pattern to help with proper use. Pull end of dressing out from one side and pack into wound directly over the source of bleeding. When the wound is packed, apply direct pressure using the rest of the dressing. Continue to apply pressure until bleeding stops. Use a pressure bandage over the wound to maintain bleeding control.
After the initial pack has been made, you must fill the cavity to secure the gauze in place and prevent it from shifting during patient movement. The cavity should be packed as tightly as possible and all the way to